The central nervous system consists of both the brain and the spinal cord. And just like any other organ in the body, they are prone to infections, including bacterial, viral, fungal, and tuberculous infections. Before discussing these infections and their different types, let us discuss the anatomy of the brain. This is a coronal view of the brain. If you take a part of the wall, also called meninges, which is the outer protective covering of the brain, you can identify three layers. External to internal, they are the dura mater, arachnoid matter, and pia mater. The dura mater is attached to the skull and skin, while the pia mater is attached to the brain. Between the dura and the skull, there is the epidural space, and between the dura and the arachnoid, there is the subdural space. Moreover, between the arachnoid and the pia, there is the subarachnoid space, which contains the cerebrospinal fluid. The contents of this cerebrospinal fluid are tightly regulated by the blood-brain barrier, which are tight junctions allowing specific molecules to pass. The pia mater and the arachnoid together are called leptomeninges, and this is where meningitis occurs. Infections can occur in any of these covering layers, as well as in the brain, called encephalitis. CNS infections are of great importance because they can induce direct damage to nervous tissue or indirect damage by toxins and the inflammatory process. However, we said that the brain is secured by the tight blood-brain barrier. So how do these infections reach the meninges and brain? There are four ways. The first one is hematogenous spread by arteries due to a blood-brain barrier defect or anastomosis of veins and sinuses of the skull. The second method is what we call direct implantation, post-traumatic or due to a lumbar puncture in which the needle introduces microorganisms to the cerebrospinal fluid. The third way is local extension from the skull or spine from an infected tooth or osteomyelitis. The last mean of spread is the peripheral nervous system, in which some pathogens such as rabies and herpes zoster can travel in the nerves. After introducing the subject of CNS infections, there are four types, which include epidural and subdural infections, meningitis, parenchymal infections, and meningoencephalitis. To start off, I'll be explaining the epidural and subdural infections. As discussed earlier, the epidural space is between the skull and dura, while the subdural space is between the dura and the arachnoid. As you can notice, these layers are easily accessible since they are close to the outside. So most of these infections are bacterial and fungal that enter by direct local spread. Epidural and subdural abscess, which is a collection of pus, most commonly occurs due to osteomyelitis and infected air sinuses. They do not affect the arachnoid, but a large empyema can produce a mass effect and thrombophlebitis, which is a venous occlusion that can cause brain infarction. This patient presents with fever, headache, and neck stiffness. Treatment is fairly easy, and complete recovery is achieved by surgical drainage of the abscess. Moving on to the more interesting part of this video, and the second type of infections, which is meningitis. As aforementioned, meningitis occurs in the leptomeninges, which is the arachnoid and the pia mater, with the middle space, the subarachnoid space. Spreading of these infections down to the brain results in meningoencephalitis. Meningitis is typically divided to three main types based on the cerebrospinal fluid characteristic findings and clinical picture. These types are acute pyogenic meningitis, aseptic meningitis, and chronic meningitis. Starting with the first type, which is acute pyogenic meningitis, also called bacterial meningitis. There are many bacteria that can cause this type, but a special thing about meningitis is that the age group is related to the bacteria. So neonates are affected by E. coli and group B streptococci, while adolescents and young adults are affected by Neisseria meningitidis, and the elderly are affected by Streptococcus pneumonia and Listeria monocytogenes. These bacteria, as in any other disease, can cause the recruitment of inflammatory cells like macrophages and neutrophils that can cause damage. Now, what is the morphology of this patient? This patient will have exudate on the surface of the brain in the leptomeninges, as well as engorged meningeal vessels. If the inflammatory cells penetrate the leptomeningeal veins, they can cause focal cerebritis or ventriculitis. Thrombophlebitis may also cause venous occlusion and hemorrhagic infarction. As for the clinical picture, the patient presents with headache, photophobia, which is bright light intolerance, as well as clouding of consciousness, in which the patient feels zoned out. This patient also presents with neck stiffness. As for the diagnosis, lumbar puncture, which is the insertion of a needle between your lumbar vertebra, commonly L3 and L4, to extract cerebrospinal fluid, you can notice increased pressure, as well as abundant neutrophils and proteins, and decreased glucose due to the fact that the bacteria will consume much of the glucose. And clearly, if you do a polymerase chain reaction, you can notice the abundance of one of the aforementioned bacteria by gram staining. Moving to the treatment, it is by relieving the increased intracranial pressure and antibacterial drugs. Moving on to the second type of meningitis, which is aseptic meningitis, also known as viral meningitis. We refer to this type as aseptic because there are no recognizable organisms. This type is less severe than the bacterial type, as it is usually self-limiting. Once performing a lumbar puncture, you can notice an increase in lymphocytes opposed to neutrophils, as well as slight increase in proteins and no increase in glucose, since viruses do not consume glucose. The last type of meningitis is chronic meningitis, which can be subdivided to tuberculous meningitis, neurosyphilis, and neuroborreliosis. Tuberculous meningitis is due to Mycobacterium tuberculosis, which reaches the cerebrospinal fluid by hematogenous spread from the lung to pulmonary capillaries. This may lead to a well-circumscribed intraparenchymal mass called tuberculoma. Regarding the morphology, grossly the subarachnoid space will contain fibrinous exudate, obliterating it and surrounding the nerves. In addition, there will be white granules over the leptomeninges. Arteries in the subarachnoid space may show obliterative endarteritis, which is inflammation of the arterial wall. On microscopic level, you can notice inflammatory cells with well-formed granulomas, in addition to caseating necrosis and giant cells, just like tuberculosis in other parts of the body. The complications of this type are headache, malaise, mental confusion, and vomiting. In order to diagnose a patient with tuberculous meningitis, a lumbar puncture is performed to reveal pleocytosis of both polymorphonuclear cells and mononuclear cells, as well as increase in protein levels and moderate to reduced glucose. The second type of chronic meningitis is neurosyphilis, a tertiary stage of syphilis, meaning that it occurs late, and it is the most severe form, which occurs in 10% of untreated cases, and the risk increases with HIV. This type can cause three of the following: paretic neurosyphilis, caused by the invasion of Treponema pallidum to the brain, commonly in the frontal lobe, resulting in progressive loss of mental and physical functions, like mood alterations, ending in dementia with gliosis and proliferation of microglia. Tabes dorsalis is another form of neurosyphilis due to damage to sensory nerves in dorsal roots, resulting in locomotor ataxia, which is inability to control body movements. Charcot joints, which are damaged joints, loss of pain sensation, as well as absence of deep tendon reflexes. These patients present with loss of myelin and axons in dorsal roots. Meningivascular neurosyphilis, in which the infection leads to obliterative endarteritis and cerebral gummas, which is a mass lesion rich in plasma cells and lymphocytes. The last type of chronic meningitis is neuroborreliosis due to spirochete Borrelia burgdorferi, which causes Lyme disease. This is all for this video about CNS infections. I discussed the basic anatomy of the meninges, as well as the subdural and epidural infections, meningitis in its types with their morphology, complications and diagnosis. The next video will also be about CNS infections, including parenchymal infections and meningoencephalitis. Thank you for watching.